Hi, my name is Colin Meshley. I'm a fellowship trained foot and ankle surgeon with Town Center Orthopedics. I have been with Town Center for a year. So I started out of fellowship. This is my first job. I've been here from September 1st of 2022 to September 1st of 2023. And I specialize obviously in foot and ankle. Yeah, what are the symptoms of ankle arthritis? So, one of the most common symptoms usually with ankle arthritis is pain. That can be pain with weight bearing, that can be pain with range of motion, or pain that may increase with activity such as walking, exercise, anything like that. Another thing that's really common with ankle arthritis is stiffness. So, the ankle joint itself starts to lose range of motion, you start to get stiffness in the area. Outside of stiffness, we have swelling. Swelling is very common and also usually corresponds with pain. And then not uncommon to have some sort of deformity, especially in later stages of ankle arthritis. And then I would say one of the very common things of symptoms of ankle arthritis is if you've had a history of any sort of ankle trauma, so ankle fracture, pilon fracture, usually if you've had a history of trauma, likely that you're going to have some sort of ankle arthritis down the road. Ankle arthritis is commonly diagnosed through, I would say, starting with physical exam. So going through physical exam, we're going to take the patient through, range of motion. Is there clicking, popping, grinding? Do they have decreased range of motion? So if they're not able to flex or extend their ankle joint like they used to be, that can be a pretty classic symptom of ankle arthritis. And then after you do physical exam, likely we're going to get some sort of imaging. I always start with X-ray, so your common AP, mortise, lateral X-rays, just showing is there arthritis, so decreased joint space, cystic changes. Also, advanced imaging can be very common as well, and that could be either MRI or CT scan. But I'd say most commonly ankle arthritis is diagnosed through physical exam and then plain radiographs or X-rays. Yeah, so when a patient comes in with ankle arthritis, usually I like to start conservatively. And I'd say right away, if they're having pain with exercise or pain with weight bearing, I like to do start, activity modifications. And then commonly because it's an arthritic condition, not uncommon to have take NSAIDs or non-steroidal anti-inflammatories, which can be oral or topical. Physical therapy is very common with ankle arthritis. And then you get into some more conservative care, which would include bracing, so Arizona brace or leather ankle gauntlet. And then as we get a little more aggressive, we think of injection. So this could be a corticosteroid injection, could be a PRP injection, or a stem cell injection. And then from there, if conservative therapy fails, then you're looking at something more surgery. But conservative wise, activity modification, bracing, NSAIDs, oral or topical, and then injections. So when is surgery recommended for ankle arthritis? So usually after conservative therapy has failed. So if a patient's come to me and they have failed conservative therapy, we've done bracing, we've done injections, they're, currently taking NSAIDs and they continue to have pain, I always go through with my patients and I say, when is it time for surgery? One, when you're debilitated, so it affects your activities of daily living, affects what you love to do. Usually it's time to have the discussion about surgery. So I always tell patients, if you love to walk your dog, can't walk your dog because your ankle arthritis is debilitating, it's time to have the discussion. If you can't walk, get up to go to the bathroom to eat, then it's usually time to have the discussion of surgery. So I always say surgery is usually indicated when you fail conservative therapy, failed PT, failed bracing, failed injections, continue to have pain, and it starts to affect your activities of daily living and affects what you love to do. Then usually it's time to have the discussion of surgery.